May is Stroke Awareness Month, a very important month to me. Why? Because I am a stroke survivor. Now, today I'm going to introduce you to a neurologist who explains why stroke affects people of color more, how to prevent a stroke, and what to do if you have one. You'll meet a woman whose husband passed away from stroke, and how she turned that tragedy into a cause. I also say always that hope is a very powerful emotion. It is. And my last guest is going to share his company's hope for the future of stroke prevention. Dr. Bruce Obiagalay, thank you so much for being on All Things Men. And you are the director of the Olive View UCLA Stroke Program and assistant professor of neurology at the University of California, LA. The AHA, American Heart Association, and the ASA, American Stroke Association, figure prominently in your bio as well. First question, because it's a question I had. What's the difference between a cardiologist and a neurologist?
Well, thank you so much, Mark, for having me. I should please just make an update to my affiliation. The one you mentioned was a little while ago. So I'm actually at the University of California, San Francisco, and I'm a professor of neurology and associate dean here. So great question. So a neurologist is a specialist, a medical specialist, who takes care of the brain. In particular, takes care of disorders or challenges with the brain that have to do with blood supply. And then you have a cardiologist who's a medical specialist who takes care of the heart, largely challenges that have to do with blood supply of the heart, but it also extends to other things as well. So one specialist takes care of the heart, the cardiologist, the other specialist takes care of the brain, the neurologist.
Which two groups are affected more by strokes, African Americans or white people, and why?
Absolutely. Unfortunately, we've known for over 50 years that African Americans are much more affected by stroke than their non-Hispanic white counterparts. And so to give you an example, we know that African Americans are twice as likely to experience and die from a stroke compared to their non-Hispanic white counterparts. We've known this for over 50 years. Now, what's the reason for this? We can explain about 40% of this difference between African Americans and their non-Hispanic white counterparts based on, one, access to care, the presence of risk factors for stroke, like hypertension, that's high blood pressure, or diabetes, high blood sugar. However, we still can't explain a good proportion of why there is such a difference between both groups. Even after you account for those things I just mentioned, there is still a gap that we need to better study and be able to bridge if we're going to make some progress in making sure that there's equity in outcomes between both groups.
Doctor, I myself am a stroke survivor. I was in a coma for 2 days, intensive care for a week, rehab for a year. I had to learn to walk and talk and swallow again. You kind of mentioned about that, but what would you have told me before my stroke to help me better to protect myself from having a stroke?
Absolutely. So I think the first important piece of knowledge is to recognize that as an African American, you're at higher risk for a stroke. So that level of awareness, I think, is extremely important. That's number one. Number two, the other thing to know is that it's actually African Americans between the ages of 34 to 64 that are at highest risk of stroke. So actually, when you look at that particular age range, they're at almost 4 times higher of experiencing a stroke than their similarly aged non-Hispanic white counterparts. So if you fall in that range, it's especially important for you to be aware that you could be at very high risk. So that's one thing. I spoke earlier about the risk factors for stroke. These are conditions that increase anybody's risk for actually experiencing a stroke. These are things like hypertension or high blood pressure, diabetes or high blood sugar, high cholesterol, stress, smoking. So these are things that if you have, you should definitely be following your doctor's instructions to make sure they're properly controlled or treated, because we know, based on lots of studies, that if you treat blood pressure, control it properly, your risk of experiencing a stroke is much, 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 much lower. So you can actually prevent stroke. The beauty of stroke is that we know that 80% of strokes are preventable. So knowledge is power in this situation. So controlling high blood pressure, diabetes, not smoking, trying to rest when you can, following your doctor's instructions, extremely important. The other thing I should mention is that, of course, prevention is always better than cure. I always tell my patients the best stroke is a stroke you never had. But let's say somebody has a stroke. It's important to know what the warning signs of a stroke are, because we know that we have treatments for stroke that can actually dissolve or remove the blood clot that causes the stroke in the first place. But we can only give those treatments in a very short or narrow period of time. So we can give those treatments within 24 hours of when the stroke symptoms began. They could be given through the vein or they could be given through the artery. But you have to know that you're having a stroke, be able to call 911 and then get to the hospital and then be able to get this particular life-saving or at least disability-preventing treatment. And so what are the things one should recognize when one is trying to think about the symptoms of a stroke?
Doctor, it seems that stroke patients, survivors, are getting younger and younger. Why is that?
Well, it's an interesting question. We don't know exactly. Well, we feel that one of the reasons might be there has been an increase in sedentary lifestyle. And so there's been an increase in people being more obese, having more diabetes. And as I mentioned, those are risk factors for stroke. We also know that generally, when you look at our population, because our population is becoming less white with time, many of the people who are experiencing a stroke are on the younger side. Remember, I said between 35 and 64, highest risk for stroke. So that's why we think that might be happening. And so I think the issue there is, of course, for people to watch their weight very carefully, make sure they follow their doctor's instructions. But you're right, there is a greater tendency for strokes to be occurring at younger ages now. And so if you look over the last 20 years, because we have better blood pressure treatments, better cholesterol treatments, you see actually the risk of stroke and the risk of dying from a stroke has actually gone down in everybody. But it's gone down much, 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 much less in African Americans and Hispanics than it's happened in non-Hispanic whites.
Doctor, I'm living proof there is life after stroke. I'm sitting there talking to you. Tell me a bit about life after stroke and what that entails. What do you have to do?
Well, so again, I must say that one, of course, it's very important that stroke is prevented. And so we know that once somebody's had a stroke, 9 out of 10 stroke survivors still report some kind of symptom. So even if you see them, they seem to be completely fine. They know they're not altogether 100%. So that has to be established. Again, that's why we want to prevent stroke as much as possible. But of course, thankfully, you've recovered very, very well. At this point, the next thing to again focus on is prevention, because the strongest predictor of having a stroke is having had one in the past. So fortunately, there are so many people like you, Mark, around the country who have fortunately survived a stroke. But one has to take into consideration very strongly that there's a high risk of having another one. And so all the medications, all the instructions that the doctor gives to a stroke survivor are very important to try and reduce that risk of, God forbid, a second event occurring.
Dr. Bruce Obiagalay, thank you so much for being on All Things Men. And you, my friend, have a great day.
I wish you the same. It's such an honor. Thank you, sir.
Thank you. Deanna Coopersmith-Marquez, you are the president and founder of the Scott Coopersmith Stroke Awareness Foundation. First of all, welcome and Good to see you. We've known each other forever.
Yes, we have, and it's an honor to be here with you today. Thank you for having me on.
Okay, Deanna, let me ask you a question. How did stroke find you?
Well, it found me probably the way it finds most people, unexpectedly and certainly uneducated. Back in 2009, I was happily married, beautiful son. And one morning I woke up and my life changed. My husband had had a massive stroke.
Now he, I hate to say passed away, but then you began to get busy. What happened?
So Scott was on life support for a week after his stroke. Um, Unfortunately, there was nothing that the doctors can do. His stroke was in his brainstem, and he was no longer with us. And he passed away on July 22nd. And the following, that was the worst year of my life, for our entire family. It was just a very trying, difficult year, having a 2-year-old and losing my husband at 29. And, we really struggled. Around the year anniversary of his passing, his brother and I, we decided that we wanted to do something positive. We wanted to honor Scott, and we wanted to, do something that mine and Scott's son would appreciate moving forward. And so I think our first event was more selfish for us as a family, giving us something to do, to focus on, to be able to get through that anniversary, the anniversary of his stroke, and then the anniversary of his passing.
I've spoken twice at your dinner. Tell us about the foundation, about the dinner, and why you decided to, you talked about a golf tournament, but when I got there, it was this big, huge event. That's because of you.
Yes. Well, the golf tournament was successful. And again, we really enjoyed doing the work that we were putting in. But the problem that we felt was we raised this money, but we had no idea where that money was going. Was it going to research? Was it going to survivors? We just didn't know. So that's when we decided to, maybe we need to open up our own foundation and have a little bit more control over where the funds go.
Deanna, I have to mention Lucas, great guy. And I have to mention what the union between you and him produced. Tell us about that.
Well, I mentioned I was a 29-year-old widow with a 2-year-old son, and thought that was kind of the end for a while there. And yet I was blessed to have found an amazing man. Ironically, he was best friends with Scott's brother, Craig. So he knew Scott back in high school. He's kind of been in our lives from day one without us even realizing it. And he's amazing. He's one of our board members. He is my biggest cheerleader when it comes to the foundation and the time and energy that goes into it. And he and I together had a beautiful daughter who's now 7 and a Spitfire. And she just, I never thought, I was an only child growing up, and now I have 2 kids. And I thought, 6.5, 7 years apart, they're never going to fight. Well, I was wrong. And they corrected me very quickly, because most days I play referee for the 2 of them. But I love it. I'm blessed. I'm definitely blessed.
Deanna, I want you to, every now and again, check your wings behind your shoulders. You are an angel, and you're going at halo, the whole thing. And I think it's well deserved. And also, I don't say it lightly. I mean every word I say. You are an angel. Deanna Coopersmith-Marquez, thank you so much for being with us.
Thank you so much for having us. I appreciate it, especially during Stroke Awareness Month. Really, really appreciate the work that you're doing, and thank you for having me on.
Have a great day.
You as well.
I know what you're thinking. You're thinking we're not doing Zoom, but I've been vaccinated. Gil has been vaccinated. Gil Vallejo. Coming up, we'll be talking about something that could change your life. You'll see coming up. Gil Vallejo of Odin Technologies, welcome to All Things Men. Now, as you go to the website, it says you're the Director of Military Operations, but you do more than that. What do you do?
So actually with Odin Technologies, it's my responsibility to make sure that the military is aware of what they're doing. But on top of that, I also work with, business development, with them. But on top of that, like I said, I do that in my free time.
You have free time?
Yeah, right. That's a good one. So actually, yes, I'm also the project coordinator for the Defense Health Agency as the simulation subject matter expert for combat simulation.
How did Odin Technologies find you?
Mr. Stephen Hansen, the CEO of the company, he and I have a mutual friend named Gloria. She's out of California. Well, she knew Stephen and the device that he had created. So she called me and asked me what I thought about the device. So I said, sure, no problem. After we talked and he showed me the device, I actually started laughing only because I could not believe that this device existed. He thought there was something wrong. Eventually I told him it's not that. This is something that the people need to be aware of. This is something that the military needs to know about.
Okay, that device, let's cut to the chase. What is the device?
So the device is it's almost like a pressure tester, if you want to say. It checks the perfusion within the body. The best thing to do it without getting medically is in a house right now, there's a pressure system, your water system, that tells you exactly how much pressure you have in the house for water. If you were to turn on a faucet anywhere in this house, there's a pressure gauge outside of your house that would says, hey, something is running in the house. So think of the vascular system within your body exactly like that. It's the size of your watch. I could put it on your body and it runs. It gives me over 100 data points per second at that. So if you have a perfusion problem, if you have a bleed within your body, that device will actually tell me there is a leak somewhere. We need to go find it. And that's exactly what that device is.
Gil, I always say hope is a powerful thing. Let's talk about how this device can give hope to people like me, stroke survivors.
So actually, that's the beautiful thing. When with this device, the perfusion measuring the pressure and the volumetric blood flow, think of the implications that it can actually have. Right now, we are focusing on the limbs, but because it is volume, it is pressure, a stroke, it does the same thing. It is a bleed somewhere. It is an opening somewhere. It is altering the perfusion within the body. The goal is to be able to try to find it immediately. So you can talk to any neurosurgeon and they'll tell you right away, this device, or excuse me, the sooner you can find out that there is an issue, the sooner you can respond to it. Time is definitely of the essence. And this device actually is the time frame for us. It saves the time so we can actually treat that patient much faster.
What is the name of this device?
So, I call it the HemoFlow. Right now, we don't have a true name, for it. We're still trying to devise a true name. So it's called the HemoFlow, the Hemo device, pretty much anything. In fact, we might think about calling it the Mark.
Okay.
Yeah. So, but right now we don't really have a name for it because we're actually doing the studies for it. But right now I just refer to it as the HemoFlow because that's what it does. It's measuring the volumetric blood flow, the hemoglobins, everything within the body.
What's the inner conversation like at Odin? Do they know they have potential lightning bolt in their hands?
I'll tell you, we've been to conferences and we've been around, and they speak to doctors all the time, especially when they showcase the device. And one of the conferences, one of the more recent ones, doctors were completely coming up to them because at that time the focus was on acute compartment syndrome, an injury that you can sustain from a blast in the military. Again, which is why I got involved in this. But as the doctors, of course, they're just so brilliant. Along with Mr. Hansen, they realized they had something more than that. They realized not only can this do compartment syndrome, but this is something that we can start working on, whether it's diabetes or stroke or even heart attack. The implications are astronomical. The device is there. It'll work.
Now, where are you as far as testing goes? When do you think we'll be able to see that device on the open market?
So using military terms, that's a little more than I'm used to. So you have TRL levels, readiness levels, and let's say there's about 9 or 10 readiness levels. We are easily at a level 4. We're probably at a level 5. We can already do testing on humans and actually prove our concept, which we have done. So if you were to actually look within the military medical journals through Oxford University, you would actually already see the papers already done. The system actually does work already. Now, of course, we have to make sure to now disprove that it doesn't work. We don't just want to throw anything out there. But I think if all the stars were aligned today with the proper money to continue with the research and development, I'd probably say about 2 years we can actually have it on the shelves.
Man, I tell you, Gil Vallejo, thank you so much.
My pleasure, sir.
With all the talk these days about vaccinations, let's go back to the early 1700s. Smallpox was ravaging the colonies, and there was not much authorities could do beyond imposing quarantines and treating the sick. That changed in 1721 thanks to an African slave named Onesimus. He shared the practice of variolation used to prevent smallpox epidemics in Africa. It worked by pricking the blisters of smallpox patients and using the pus materials to inoculate a healthy person against the disease. Onesimus's contribution to the understanding of smallpox saved countless lives, and this prevention lives on today. I want to thank all of our guests who are on our show today. Now, if you want to be part of the conversation, hit us up on Facebook or Twitter at All Things Men BNC. As always, I'm your host, Mark McEwen. I'll see you next time.